you don't get any more belly pains? That's good.
Maintaining an optimal level of wellness is absolutely crucial to living a healthier and quality life. The need to promote such healthy living is the reason a well-meaning government formulates clear-cut health policies and undertakes actions that will facilitate the provision of quality healthcare system for its citizenry. The world, no doubt, is facing multiple health challenges, and one of such health issues is the sickle cell disorder. The enormity of this particular health challenge caused the United Nations General Assembly to adopt a resolution recognizing sickle cell anemia as a public health problem and world's most genetic disease. According to World Health reports, 70% of the world population are carriers of these genetic traits. In Nigeria, a sizable number of the population bears the burden of the disease, even as the country is ranked top on the table of sickle cell endemic countries in Africa. The disease is said to be responsible for an annual infant death of about 150,000 children, representing more than 8% of infant mortality in the country.
Sickle cell is a black race problem, and the earlier the black man takes the initiative to tackle it, the Caucasians, other races will not be in the forefront of this campaign. So I'm quite delighted that we are taking the bull by the horn.
To fight this ugly scourge, the wife of the Delta State Governor, Dame Edith Okowa, through the instrumentality of her pet project, the O5 Initiative, embarked on a robust health program designed to first change the fortunes of the sickle cell warriors, and secondly, to halt the root cause of the spread of the disease through an aggressive sensitization campaign.
Our mission is like we are going to reach out to people one person at a time. It is my belief that I will be able to establish sickle cell clinics all over the central hospitals in Delta State. These ones are just clinics where a patient can just go and get first aid.
The First Lady is fully committed to alleviating the plight of people living with sickle cell disorder. A clear demonstration of love, compassion on the part of the First Lady, and especially of immense benefit to people living with the plight of sickle cell disorder.
We know what the sufferers, what they go through, and having centers all over the place is actually reducing the burden on them. And also the cost, because we know it is quite an expensive disorder to take care of. And if they are able to access medical facilities like this, it eases them a lot.
The burning desire to make a remarkable difference has led the Delta State First Lady to pursue the establishment of sickle cell clinics across the state. At the last count, 12 of such functional model clinics and a world-class referral center in the state capital have been established by the O5 Initiative.
It's built as a center of excellence for sickle cell disorder management. It speaks a lot about the determination of His Excellency, Her Excellency too, to see that health for all Deltans is achieved, and not just all Deltans really, because here will serve as a center for persons not just in Delta State but other states of this nation, even beyond this nation.
Sickle cell is everywhere, so she has put the machines that they use in testing the sickle cell disorder. So those machines are the ones she has put in all these places, and this big one is a referral center. So anything they can manage in the whole of the little centers, they'll bring it to here.
I'm very grateful that this referral center is here. I completely believe it should actually be a South-South referral center for the South-South region. So this is good, and I hope that this will meet the needs of so many people.
The world-class sickle cell referral center, which is only second to the center in the Lagos State University Teaching Hospital, Luth, stands as a testimony to a dream conceived 4 years ago by Dame Edith Okowa. The facility is well equipped with state-of-the-art instruments. Prior to the commissioning and donation of the facility to the state, Mrs. Okowa rallied the support of well-meaning individuals and organizations to properly equip the center.
I commissioned this sickle cell center to the glory of God, in the name of God the Father, God the Son, and God the Holy Spirit.
Every one of these clinics is fitted with modern equipment, quality furniture, and manned by skilled and knowledgeable personnel. Our conviction that people with sickle cell disorder can live normal lives once they can easily access specialized health care provided by professional and compassionate caregivers motivated us to establish these clinics.
Sometimes I ask my wife, are you not putting too much pressure on these people? Because every one of those clinics have been established with the money of persons. Majority of them within Delta and a few from our side. And I thank each and every one of them, Senate Bank Chairman and many other persons who have donated generously to create a center that can impact on the lives of people.
This referral center will go a long way in creating the awareness how people view sickle cell, people knowing their blood group, and I think it will go a long way in saving lives. I know of the one in Lagos, in Lod, that's the national one. I don't know of any in any state. This is one of the first. It will be wonderful to see it, even when she leaves office, to see this sustained. It will be a blessing to a lot of people, to Nigerians in general, not just Deltans.
Besides the serenity of the environment where the referral center is located within the Asaba Central Hospital, the facility boasts of a number of well-coordinated units, among which are a well-decorated reception, transcranial room, prenatal and exchange blood transfusion unit, exchange blood transfusion room, leg ulcer treatment room, amenity ward, hemoglobin laboratory, a genetic counseling room, nurses station, a well-stocked pharmacy, modern library and waiting room, 2 consulting rooms, laundry and rest rooms. Each of the units is well equipped with quality furniture and are manned by skilled and knowledgeable personnel.
Strengthening laboratory services across the state. In the 12 hospitals we support, we've been able to strengthen, in fact you have the version next to this in all the 12 other supported sites. So we want to commend Her Excellency, which has done a lot to strengthen laboratory services in Delta State.
This center is being run in line with the initiative of this Delta State government, the free under 5 care. Children less than 5 years, everything here is free. Previously, when you want to do things like a transcranial Doppler ultrasound, which is available here, you have to send the patient to Lagos. So with this here and with all the facilities available, it's hoped that this will reduce the death rate of children living with SCA.
Sickle cell anemia, we all know, is a problem that we have generally, and it needs specialist care. And as I understand, in Nigeria, there are only 2 of such facilities. So for Her Excellency to endeavor to put one in Asaba is definitely very good for everybody in the state.
The opening of the center was graced by several dignitaries from outside the state, among which are the wife of the governor of Edo State, Mrs. Betsy Obaseki, and Mrs. Udom Emmanuel of Akwa Ibom State. The center has made remarkable progress and is counting its gains daily.
Sickle cell is a disease for the black race, and Nigeria is the largest black race on earth. So having this here as the second largest sickle cell center is a big thing you're doing. It will serve not just Delta State. Maybe sometime in the future we'll have to name this the South-South Sickle Cell Center.
The services at the referral center is effectively supported by the Primary Healthcare Development Agency at the other 12 sickle cell clinics, which are located at Ugeli, Sapele, Urerope, Ole, Eku, Patani, Koko, Otu Jeremy, Kwale, Abo, Umunede, and Iseluku.
In the name of God the Father, Amen. In the name of God the Son, Amen. And in the name of God the Holy Spirit, Amen. We declare this clinic open for life, not for death. In Jesus' name. Amen.
I didn't know the power until when this same center was created in my constituency, and the people today, they are happy. The most important is not just creating a project, but it's the passion to carry on with the project, and she's doing extremely well.
Her Excellency, the wife of the governor, she didn't start with this big center. She had gone around the state and had sickle cell clinics distributed all over the place. So people in the rural areas have an opportunity of accessing treatment in the general hospitals. The genetic counselors are being trained to man these areas. There is an impact already.
I know this sickle cell center has been built in Nabo, in other places. So I know that instead of those people that don't have those amenities to start journeying and on their way, they are dead or something, it's closer to their locations. I know this is something that has come to cushion effect of financial stress in their lives.
The fact that sickle cell patients face peculiar health challenges, including episodes of pain, frequent infections, delayed growth, and vision problem, not to mention the social stigma associated with the disorder, were some of the reasons behind the First Lady's vision of establishing one clinic per local government area.
She's done this across the state, showing her passion, showing that she's very serious about helping to eradicate or at least minimize incidence of sickle cell.
I really want to thank God for that initiative given to Her Excellency for this 05, going about helping the less privileged, the sickle cell people who cannot take care of themselves. She's just out there, give them all the facilities needed for their health. It's just divine vision.
These centers provide screening to identify patients and the development of holistic sickle cell disorders (SCD) care programs for therapeutics and education for families and children with SCD. Through the instrumentality of the 05 initiative, many lives have been touched in more positive ways. A vision called from Matthew chapter 25, verse 35 to 36, feeding the hungry, clothing the naked, visiting those in prisons, and visiting the sick, as well as providing home to the homeless.
These are people that ordinarily wouldn't have had any help, but based on that injunction in that Bible passage, Dame Edith Okowa, driven by the passion of helping the helpless, took up that mandate, and we've been feeding the hungry, we've been visiting the prisoners, we have been clothing the naked, and we have been visiting the sick, which are the 5 stand legs of 05 initiative.
This is a timely intervention. It's about saving lives, it's by preserving lives, and it's by adding value to life, preserving a life that becomes great tomorrow, today.
She has been a mother in the state. Health and related issue has been our primary concern, and our initiative 05 has done a great job. The Almighty God will continue to bless her.
The importance attached to these group of persons propelled Dame Edith Okowa to join the rest of the world on the 19th of June every year to constantly raise awareness of the disorder at both local and international levels. The 2019 event in the state held at Warri, the state's commercial nerve center. The sickle cell warriors, as they are called, trooped out en masse to share the auspicious moments together.
And give me another S, and that is Jesus. Thank you so much.
It's an honor that Her Excellency is celebrating with the warriors.
It's a very laudable program, and if you look at the content of the initiative since they started it, you'll see that a lot of warriors, a lot of people with sickle cell disorder are benefiting from Her Excellency's initiative. So we appreciate what she's doing.
Smart Delta.
As it is in our custom to bring you the sights and sounds of events around the state, the Smart Delta team did not hesitate to travel around some of these special clinics to bring to you reports of real people, real stories. We paid a visit to the Sickle Cell Club meeting at Okwe General Hospital in Asaba to see for ourselves and interact with this success and survival personalities. What we saw was captivating. The sickle cell warriors looked very healthy and cheerful and were seen sharing ideas and experiences, after which the senior sickle cell warriors gave testimonies of their secrets to healthy living, thereby encouraging the younger ones. 68-year-old Mrs. Veronica Ajabuno, a mother of 4 and grandmother of 8 children, is a retired medical laboratory scientist. She took to sickle cell research as a result of being an SCD patient. Nsebunam Chidalo and others also told their success stories about how they have remained optimistic in their daily endeavors.
My own secret is, first of all, take good food. Stay in a clean environment. Then don't just get anything because other people are eating it like that. You follow them.
My secret is seeing myself beyond what sickle cell is. Seeing myself stronger than sickle cell. Whatever I'm doing, I try not to overstress it. This secretive about being HBSS, that stigma, that's the first thing we should fight, and that is what we are fighting.
I'm sickle cell. I've never had any reason to hide it because I know I'm good the way I am.
Her Excellency, in fact, I applaud everything that she has put in place for people living with sickle cell disease. She has done so much. Things that normally they have to pay for. But when they come here, they are given those items free of charge.
Their genetic counselor, the chief medical director, also spoke to us on the benefits of the support being provided by Dame Edith Okowa.
Her Excellency is really doing a great job. People now know that it's not a disease, it's not a death sentence. They now know how to live with it. So I would say that it has a great impact on the prevention of crisis.
We've appreciated the good things she has done here so far. Ab initio, when I came here, the sickle cell center was a small room that was not really functional, having just one nurse. But on inception of our 05 initiative, there's been an improvement in attention to patients, and then facilities have also improved. So we really appreciate what the First Lady of Delta State is doing.
Although sickle cell anemia cannot be cured, truth is it can be managed through simple measures. This is why Dame Okowa Sickle Cell Program is ensuring that these affordable, common sense interventions are available to all people suffering from the disorder so that they can enjoy healthy and productive lives.
It's a relief to parents because they are not aware that sickle cell patients don't give up like that. She has also sensitized parents, including me, that sickle cell is not what can just kill somebody like people used to think. Now that she has brought clinic, parents like me, we are happy. Monthly we come here for treatment. The area we appreciate mostly is that these drugs they give to our kids are free of charge.
These are projects and our programs. We live forever. That's my prayer. It makes me feel good that she's able to touch lives in this manner. Children that would have ordinarily been abandoned. Children that would have even lost hope. She has given hope to all of them. She has named them success and survivor children. She has named them warriors. What else do you want from? She's done it all.
Just as the myth behind the sickle cell disorder is gradually giving way to more enlightenment campaigns and awareness, these sickle cell warriors still clamor for more voice to be added to reduce drastically the level of stigmatization meted to them. This has forced many to hide their status, thereby causing more harm than good. The challenge posed by the disorder therefore calls for love, support, care and attention, and Dame Edith Okowa has been in the forefront of this crusade, urging parents to brace up and face the challenge. Her free care and treatment centers are a step in the right direction to cushion the financial effect.
If you've ever had somebody close to you that either has sickle cell or has passed away from sickle cell, then you will know what it means and how important this facility is for the people of Delta State. In time past, people didn't really know what sickle cell was all about, and they thought it was a myth or something. So now with a lot of awareness, everybody knows what sickle cell is. So it's definitely a step in the right direction. We commend Her Excellency for this initiative.
She has done so much, especially in the area of this sickle cell. She has taken the burden beyond where anybody have ever done before in this state or even in this country. So I want to really appreciate her for so much she has done. So what she's putting in place now is out of compassion of the feeling of those that are passing through it to bring relief.
At Eku and Orerope centers, the warriors expressed their joy over the establishment of the facilities. They testify that the right rate of ignorance about one's status has reduced. As such, they commended the efforts of Dame Edith Okowa.
The hospital, they help us, the drugs, they are free, the nurse, they are good. Everybody in this hospital that is working here, they are good. And we thank the wife of Okowa for helping us to build this hospital.
At the waka, they run, carry my pikin, they go different hospital. They spend many money, but since when they build this hospital, I know they spend money again. The tablet when they give us, they help my pikin. They make the Okowa, God will bless her.
I really want to thank the First Lady Dame Edith Okowa for setting up this clinic, because to some extent the death rate with the children or adults with SS has actually reduced, because now they know what to do and how to take care of their children, because many of them feels is a dead end, but after the counseling and all that, they feel relieved and they're happy coming for their checkups.
We further took a trip to Patani local government area. Beneficiaries here said the clinic came in at an appropriate time. The clinic provided a multi-pronged answer to every of their needs. Ms. Governor, Johnson Gifts, and their colleagues who spoke to us said they have enjoyed free medical service.
It affects me financially because I don't buy drugs. Anytime, whether I had crisis, I don't have crisis, I normally come here and they give me the drugs free of charge. God continues to bless Edith Okowa for all what she has done for us. And may God give her the good hearts to do more for us.
Edith Okowa, thank her for the clinic which she opened for us, and the free drugs, the treatment which they bring on, because if not before for that they spend a lot of money. So I thank her for the things which they bring on. May God bless her.
We appreciate the governor's wife Idris Okowa. We thank her so much for what she has already done for us.
I would thank her very well, Excellency Dame Mrs. Okowa, for bringing this clinic to the grassroots. And my clients, they appreciate her very well too.
These life-touching stories of the interventions of the O5 initiative in addressing the challenge of sickle cell has been made much more manifest by the decision of Governor Ifeanyi Okowa to aggressively reposition and strengthen the state's healthcare system in order to improve the quality of lives of its citizens and to enable them live meaningful and productive lives.
Delta State today, there is no hospital where there are no infrastructure. Many of our hospitals in Delta State are properly equipped and doctors are in everywhere serving the people. So on the health area, the governor has tried very well.
The machines he added to us has improved our outcome, because when patient comes, they don't find it difficult. Again, unlike when we didn't have enough machines, it would take some of them waiting. I want to say a big thank you to Dr. Ifeanyi Okowa for bringing relief to help the patients.
The Okowa-led administration placed a high premium on the healthcare status of Deltans, and as such, it overhauled and delivered a very robust healthcare system across the primary, secondary, and the tertiary healthcare centers in the state. This is without prejudice to the state's contributory health scheme, which has carved a niche for itself in the country.
It's my husband that introduced me to this place. When I came, the way they attend to me, I like it, and I was very happy because my son is getting better. Everything is free. So I appreciate the Delta State government for what they are doing. I pray that they should keep it up.
Our health sector has been transformed vis-a-vis structural renovation, drugs, and health insurance, something also introduced, is first of its kind in this country. So I say God will bless him blessing and blessing for all his tribes.
To our great governor, Dr. Fine Okowa, we say may God continue to bless and protect him for his mercy towards his people. He's just too wonderful for the pregnant women.
The desire of Dame Edith Okowa to reach out to Deltans, particularly one person at a time, is on course as she deploys the services of our pet project, the O5 initiative, to the health and welfare needs of Deltans. Persons with eye defects have received treatment, individuals in prisons have been impacted, and less privileged homes are being touched. Indeed, the O5 initiative is maintaining a tradition of sharing love and affection, one person at a time.
Deltans should expect more of what we've done before. More persons will receive their sight, more eye surgeries, more homes for the homeless, more food for those that cannot feed, more of everything good from the Lord.
Come to Delta State, come and see the good things where Okowa they do you better. Run, come to Delta State, come and see the good things where Okowa they do. I see a job and work creation in Delta, make the youth say them higher. Okowa, I see good roads everywhere in Delta, make the people say them cola. Come live in Delta, say me I say, come invest in Delta. Come explore the potentials of our state.